Hello everybody, my name is Gabriella Howland and welcome to our power and agility based exercise workout. Here I will be performing about an hour to an hour and 10-minute exercise, including warm-ups and cool downs, okay? So we will do a lot of variety, specifically with plyometrics, and we'll move on to some balls and agility drills. To start off, we're going to do some jogging in place for about 2 minutes. Alright everybody, we'll begin now. As time passes, allow for me to break down what we're going to be doing today in this workout. We will have a total of 6 modalities, each with 2 main exercises and 3 sets, each with its own variation. These variations will be designed to either make the exercise easier or make it a little more challenging, and we will always start with the standard set. We will focus primarily on plyometrics, and this will take up our first 3 modalities of the day. We will be doing some upper body, trunk, and lower plyometrics. We will then transition to a quick-mix reaction drill, which will focus on our reaction and hand-eye coordination, and these will be done with the ball. Finally, we will end with some closed agility cone drills and some open agility cone drills. These will be great for practicing our turns. In order to perform the exercise correctly, we're going to need about 15 by 15 feet of space. In addition, we are going to need some equipment and a partner. The equipment will include 2 racquetballs or tennis balls and 2 medicine balls, one of a preferred weight and one of a slightly above average preferred weight for your body. In addition, we will need about 5 cones and possibly a measuring tape. Be sure to have ample access to water and make sure to take any breaks that you need to by pausing the video. Now we are starting to approach the end of our jogging and we'll move on to the next portion of our warm-up. Alright, good work everybody, that is the end of our jogging. We will now move on to our next portion with arm circles. Begin now. We will start moving forward and then after 30 seconds we will do them in the opposite direction. We are all at our own speeds in progressing in our health journey. Here, our exercises are all predominantly low and moderate intensity. If you need to switch it up, feel free to do so. But we are all at our own speeds. You got this. Alright, now begin swinging the opposite direction now. Now we will transition into some side squats, starting with the right side for about 30 seconds. Begin now. Now switch to squatting with the left leg. To finish off our general warm-up, we will be doing 1 minute of jumping jacks. Begin now. Soon, we'll be moving on to the dynamic warm-up part of our workout. A dynamic stretch is essentially a stretch that will be mainly useful in the beginning stages, or the warm-up. They will help use specific muscles that we will use in the workout. This concludes our general warm-up segment. Good start, everybody. To begin our dynamic warm-up segment, we will be doing some lunges with a side reach, starting with the right side for about 30 seconds. Begin now. Be sure that your knees are bending at 90 degrees without pushing beyond the toes. This exercise is great for working on the quads in addition to stretching the sides of the torso. Alright everybody, now let's switch over to the left leg. This type of stretch will affect a lot of muscles, including our gluteus maximus, our hamstrings, our iliopsoas, our latissimus dorsi, our internal and external oblique, and our rectus femoris. Now we will transition to doing an inverted hamstring stretch. An inverted hamstring stretch will be performed by balancing on one foot while making a T shape with the rest of your body. Begin now. This stretch will focus primarily on our gluteus maximus, our hamstrings, our hip abductors, our hips adductors, and our erector spinae. Now switch to the other leg. If you wish to enhance the stretch, use the arm that's normally by your side and reach down to tap the inside of your foot. Excellent work. Now we will transition to some arm swings. This will be done for 1 minute. Begin now. Multiple muscles are affected here, including the latissimus dorsi, our teres major, our anterior and posterior deltoids, and our pectoralis major. The next stretch we will focus on are some twist shoulders. Be sure that the leg kicking up reaches the opposite hand. So right leg, left arm. Begin now. This will continue for 1 minute. Toy soldiers are an excellent workout for the lower body, such as your quads, hamstrings, and calves. Now on to our final dynamic stretch. We will be doing some hip circles, starting clockwise. We will be doing clockwise for 30 seconds and then counterclockwise for 30 seconds. Allow for the hips to guide the body. This will allow for a full proper stretch. Now we will move on going counterclockwise, starting now. Hip circles are a personal favorite for me since they loosen the lower back and strengthen the core. It predominantly works the adductors and glutes. Remember, if you ever need a break or a sip of water, please pause the video and do so. Your safety and hydration is most important. And this concludes our warm-up. Good work, everybody. Now let's move on to our first modality. Alright, welcome everybody. For our first modality, we will be doing some chest passes and we will need a partner and a medicine ball for this. Stand about 10 feet apart. Begin now. Proceed by beginning a counter movement to cock the arms back. Hold the medicine ball and prepare to throw it over to the partner. Once they throw it back to you, try to catch it in the same position you started with, before repeating. Be sure to be in a comfortable upright stance with the feet shoulder width apart. The feet should not leave the ground. Chest passes are beneficial to a multitude of muscles, including the biceps brachii, the brachialis, the brachioradialis, and the triceps brachii. Alright, well done. Let's move on to the next set. For the second set, we will be raising the difficulty by backing up to have a little more feet in between us. Begin now. This modality focuses on increasing the power between each throw to ensure that it reaches the distance needed be. I want to stress that practice makes perfect. As you can see here, not every throw is perfect, but we work to make them as best we can. Do what is best in your level. Try to keep them as consistent as possible and aim on doing the primary movements the most accurate. In regards to the set in front of us, focus on the throw, not the catch. That is our main goal here. Try to keep the posture straight and feet on the ground. Try to move it as little as possible with the exception of maybe stepping to catch the ball. If there is trouble with having the ball reach the other side of the goal, i.e. your partner, try aiming a little bit more upwards. This will give a little height and help with the length. And with that, we will transition on to our third set. For our final set in the first exercise, we will be using a heavier medicine ball. We will return to 10 feet to modify the difficulty, but the heavier ball will require us to use more power to travel the ball. Begin now. A plyometric throw requires cocking of the arms, which means to move the arms slightly backwards before the actual throw occurs. So make sure to utilize this fact. This will help give us a lot of power in our throwing. Keep it up, everyone. We're almost halfway through this modality. And this concludes our first exercise in the modality. Now on to the next. For our second exercise in our first modality, we will be doing a two-hand side-to-side throw. We will be doing this for 90 seconds. Stand 10 feet apart and begin now. Begin with a counter movement, cocking the arm slightly back and aiming the ball towards one side of the head. Throw the ball to the one person's side. Your right is their left. When they throw back, try to catch the ball in a similar position before starting again. Be sure that your posture is comfortable and that your feet are shoulder width apart and placed on the ground. They should not have to move aside from possibly catching the ball. To ensure that both arms are getting symmetrical work done, make sure to alternate the pass on which side you're throwing on. Throw on the right, throw on the left, throw on the right, throw on the left. This will make sure that both arms get the workout needed. Now that we have warmed up and have gotten into the exercises, you may start to feel a little something. This is good. Just make sure that anything you are feeling isn't painful. We want tingling. We want a little bit of work, not pain. Alright, and this concludes our first set. Good job, everybody. On to the next. For our second set, we will be doing a similar variation where we will throw to the opposite side, and we will alternate. Begin now. Begin with a counter movement, cocking the arms backwards. Throw the ball over to the person's opposing side. You'll throw on your right and aim for their right. The feet should remain shoulder width apart and stationary to the ground, with the exception of possible moving for catching. Keep the posture relaxed and comfortable. Most of the power is going to be coming from the arms. If there is trouble having the ball reach, try to aim the ball slightly upwards to give them more airtime. This variation, like the one previous, will focus on the same muscle groups, the brachialis, the brachioradialis, the biceps brachii, and the triceps brachii. Keep it up, we're approaching the end of our second set. And that concludes our second set. On to the third. Here we will be doing some two-handed throws with a surprise direction. Begin now. Throw as if you did on the first set, throwing on one side aiming to their respective side. Your right, their left. A surprise direction means throwing it in an area without any rhythm or pattern. You could throw it on your right arm 3 times if you wanted, or just once. Just be sure to change it up and switch it around between the 2 arms. This is great for hand-eye coordination and being prepared for that external stimuli, which we will work on in other modalities too. If you're someone who struggles with responding to just one stimuli, having the partner make an auditory cue saying which direction they're throwing in may help. And this concludes our first modality. Good work, everybody. Let's move on to the second one, trunk plyometrics. All right, for our first exercise in this modality, we will be doing some sit-ups with a medicine ball pass. Get up in a sit-up position and prepare to do a sit-up. When you set from the sit-up, you will be passing it over to the partner. When they throw it back, lean back in the sit-up. Begin now. Be sure that the feet stay planted on the ground. They should have no movement during this exercise. This plyometric exercise can actually benefit multiple parts of the body, mostly the trunk. This will benefit our rectus abdominis, our obliques, and iliopsoas, but we will see a little bit of action from the hamstrings and a little bit from the arms. Good work, everybody. This completes our first set. Let's move on to an easier variation. For our second set, we will be throwing the medicine ball from a shorter distance. This will allow for us to have a little less force when pushing, but still focus on that technique. So get in a sit-up position, and when you rise from that sit-up, push to your partner. Begin now. As you can see, just like before, we will descend back down whenever the partner throws the ball back to us. This will help us utilize the momentum and gain more power. Ensure that your feet are planted on the ground. They should have little to no movement during the exercise. Note that most of the power should come from your abdominal muscles. So when you toss that ball to your partner, try to keep that core engaged and focused. We are nearing the end of this set. Keep it up, everybody. We're nearly there. Alright everybody, this concludes our second set. Let's move on to the third, where we will have a moving target whenever we're throwing the ball. Get into the sit-up position with the ball and begin now. This variation will require you to focus on the external stimuli, also known as your partner. Your partner will shift from side to side, giving you various angles to throw the ball whenever you rise up from that sit-up. Similar to the previous two variations, sink down with the ball whenever the ball is tossed towards you and rise back up to throw the ball, using momentum with you. Ensure that your feet are planted on the ground and that your knees are about 45 degrees in angle. This will ensure that you have no little to no movement aside from those trunk areas, which is what we're looking for. Now, why are we including this change in motion with the partner? Well, a lot of sports require us to respond to another player and how they move. By doing this, this will give us a little more insight into responding to different stimuli and variations of where they may be positioned. And this concludes the end of our third set and our first exercise in our second modality. Good work, everybody. Let's move on to our second set in this modality. For our second set of exercises, we'll be doing some lap medicine ball throws. We'll be using a wall for this. So our stance should be about shoulder width apart and our knees slightly bent. We will be doing all of our rotations via the trunk. Our hips should not have to move. Engage the core and rotate to throw the ball to the wall, using that same rotation to catch the ball back. There should preferably be no movement aside from the trunk and maybe some slight movement from the feet to collect the ball. We will do about 15 reps per side. Distance yourself by about 5 feet from the wall and begin. A lot of our core muscles and muscles that aid in turning will be benefited from this, including our rectus abdominis, our obliques, our iliopsoas, our transverse abdominis, and our latissimus dorsi. A good few ways to intensify the exercise but are not covered in this video is to use a heavier medicine ball or distance yourself further away from the wall. Both versions will require you to have more power used from your trunk to get the ball to the wall and back to you without having to modify or hinder that form. Well done, everybody. This concludes our first set. Let's move on to the next, where we will use some shorter distance. Hello, everybody. Here we'll be doing some shorter distance throws. This will help those of us who are needing a little bit easier variations. Toss just as you did for the first set, only this time about 3 feet away. We will begin around now. As you can see, this variation does not change the form itself, but rather just the amount of power required to get the ball from one end to the other. This variation can also be performed with a heavier medicine ball, allowing for the user to practice a heavier ball and how to catch it with the momentum that's generated. Excellent work, everybody. This completes our second set. Let's move on to the third. For this last variation in the set, we will be using 5 feet again and just alternating the sides. Get into a bent knee position, about shoulder width apart, and throw the ball. You will throw it on the left and catch it on the right. You will do this back and forth beginning now. There will be about 15 reps per side. This is a tougher variation that requires a lot more rotation, so we will be using more from our transverse abdominis and our latissimus dorsi. If there is trouble getting the ball from one end to the other at a decent height, throw the ball a little upwards to allow more airtime. Over the course of practicing, you can lower the ball down to be more towards the head and chest level, increasing the exercise intensity. Great work, everybody! This concludes our second modality. Let's move on to the third, lower body plyometrics. Alright, everybody, for our first exercise in this modality, we'll be doing some jump over barriers. I've already set up a cone, which is about 1 foot. As you can see, we will brace ourselves by bending our knees slightly and have our feet be about shoulder width apart. Your arms will be used with momentum, adding a little counter movement before going. Begin now. These sets will be completed in 60-second increments. As previously stated, use your arms as a counter movement, having them propel to give you more momentum. Multiple muscles will be utilized during this exercise, including our quads, our hamstrings, and our gastrocnemius and soleus, also known as our calf muscles. Alright, and this just about concludes our first set in this modality. Let's move on to the next. Our next exercise will be a bit easier by using a lower barrier. To do this, I just tipped over the cone, so there's not as much height to jump over. With the knees bent and shoulder width apart, get into a starting position. Begin now. The goal of this variation is not to increase the height of the jump, but rather improve the technique and form, so that when we do increase the height, we can respond accordingly. As you get more comfortable with the technique, increase the height of the barrier, starting from half a cone, to a hurdle, and even more depending on what you're feeling. Keep it up, you're doing great. Well done, everybody. This concludes our second set. For our third variation, we are increasing the horizontal aspect of our jump by adding a second barrier to jump over. We could use both cones, but I used my water bottle for one of them. Remember to keep hydrated and drink water. We'll be jumping over both these cones. Bend the knees and jump over both. Begin now. We will do this set for about 60 seconds. Keep the knees about shoulder width apart and have them bent before each jump. Utilize the arms as a counter movement to help increase that momentum. Be sure to allow yourself a little recovery time between each jump, especially since we're doing a longer jump. Allow yourself a second just to reset. Remember to focus on the quality over the quantity of jumps. That is why we were focusing on the amount of time, so that you can modify this how you want to do it. We're each on our own journey at our own pace. Just focus on getting that technique down and doing your best. You got this, everybody. Alright, and this concludes our third set in this exercise. Let's move on to our second set of exercises. For our second set of exercises in the lower body plyometric section, we will be doing some lateral barrier hops. Pushing your feet about shoulder width apart and begin for a jump with the knees bent. Begin now. These will be done in 60-second increments. Begin with a counter movement, allowing the knees to bend more before jumping. The arms will also be utilized as a form of momentum, thrusting forward when we jump. Multiple muscles will be recruited for this exercise, including the quads, hamstrings, and calf muscles such as the gastrocnemius and soleus. Our abductors will also be assisting for this exercise. Well done, everybody. This completes our first set in the segment. Let's move on to the next. For our second set, we will be using a lower barrier. As seen before, we have just set the cone aside to lower the height. Bend your knees and have them about shoulder width apart before beginning. Begin now. To clear the barrier, use primarily the hip and knee flexion. This will ensure that the right set of muscles are being targeted. While we're using a low cone to practice the technique, over time the barrier should be increased to a full cone, then a hurdle, to however high you aim to do. This is each going at your own pace, but it's good to start from the basics. Alright, and this concludes our second set. Let's move on to the third. For our final set in this modality, we will be doing a longer jump. As you can see, I used one cone and one water bottle to illustrate that we can use multiple devices for the height. Bend the knees and have them about shoulder width apart before beginning. Begin now. This will require a bit more recruitment from our abductors and our more lateral sides of our quads and hamstrings, since we are focusing on a bigger jump. As we reach the end of our first half of the video, I want to commend you for making it this far. We are each in our own journeys, and however far or however long you did this exercise, whether this be your first one or you've done this for ages, congratulations, let's keep pushing, make sure to drink some water and get some rest in between the sets. Awesome work, everybody. We're just about done here. Make sure to get some water, get some rest, and I'll see you in the next video.